Right, okay, so what we're going to have a look at this morning are drug therapies or biological therapies for schizophrenia. Okay, so what we have to do is we have to go through the timeline of drug development and where we've ended up today. So, for treating schizophrenia, we refer to antipsychotic drugs. Okay, and these are to lower the symptoms related to psychosis in schizophrenia, such as hallucinations, such as delusions, etc. So, in terms of antipsychotic drugs, they can be taken as a tablet, they can be taken as a syrup. If the patient fails to regulate taking their own medicine, then they would have to report to an institution for help for injections every 2 to 4 weeks. So let's have a look at the drug timeline and see how drug therapies have been developed over the last 70 years. So if we go back to the 1950s, we see the development of typical antipsychotic drugs. And the main one for treating schizophrenia was chlorpromazine. If we then fast forward to the atypical stage of drug development, so these are the ones that differ from typical drugs, in the 70s we had the development of Clozapine, which was withdrawn for a short time after trials before it was reinstated in the 80s. And in the 90s, the more up-to-date atypical drugs were Risperidone. You need to be aware of these 3 different drug therapies, and you also need to be aware of which category they fit into. We'll talk more about the withdrawal and reinstating of Clozapine very shortly. So, looking at the typical drug that is chlorpromazine, you can't take any more than a gram, 100 milligrams. Okay, absolute maximum is 100 milligrams. Typical maximum that is prescribed, however, varies between 400 and 800 milligrams. Liu and Dehan in 2009 found that the prescription of chlorpromazine has decreased over the past 50 years. In terms of how it works, it uses the dopamine hypothesis. Chemicals that are known as an antagonist is something that reduces the action of a neurotransmitter. If we have a look at the postsynaptic membrane, there will be dopamine receptors on that membrane. What happens is when the vesicles spill the contents over the synaptic cleft, the dopamine is released into the synaptic cleft, but the chlorpromazine has bound to the dopamine receptors, and therefore there is no uptake or less uptake of the dopamine. Issue is initially there is a dopamine build-up, however over time the production of the dopamine decreases because it is not being taken up. The reason why chlorpromazine works is because it reduces the hallucination symptoms. Something else that needs pointing out about chlorpromazine is it acts as a sedative, so it can be used to calm patients down. Okay, Moncrief in his 2013 studies suggests that any medication is used to calm patients down is a human rights abuse, and it's just administered to make patients easier to work with, and that is an evaluative point. If we fast forward to the 70s and the development of Clozapine was used when other treatments had failed. If you use Clozapine, and this is why it was withdrawn, there needs to be regular blood tests to check for a granulocytosis. Okay, in the trials this was fatal, people were dying from a granulocytosis, and this is because of the drastic lowering of white blood cell count in some patients. Okay, so if you take Clozapine now, you need to have regular blood tests to monitor your white blood cell count. It's not available as an injection, whereas the other 2 are, and it is taken either as a tablet or a syrup, no more than 300 to 450 milligrams per day. What's different from Clozapine and chlorpromazine is Clozapine binds on the dopamine, serotonin and glutamate receptors. So therefore it treats depression and anxiety as well as schizophrenia. Because of this, it is usually prescribed when the patients pose a suicide risk. And what we need to take into account is 30 to 50% of patients with schizophrenia attempt suicide at some point in their life. If we go on to the 90s and are looking to develop a clozapine without the side effects, then we get to risperidone. Now, risperidone binds strongly to the dopamine receptors, okay, and therefore you only need 4 to 8 milligrams and no more than a maximum of 12 milligrams. It can be taken in tablet, syrup, or injected form. It also binds to the serotonin receptors as well, but not as strongly. So let's have a look at the evaluative points of the AO3. So we know through various drug trials that medication treatment of schizophrenia is effective. So if we have a look at Thornley et al.'s 2003 study, there is the Chlorpromazine group and the other control group that used the placebo. In 13 trials with 1,121 patients, Thornley et al. Found that there were better functioning patients after taking the chlorpromazine and there was reduced symptom severity. In a further 3 trials with 512 patients, there was a lower relapse rate for those who took chlorpromazine. In another study by Meltzer 2012, clozapine was found to be more effective than typical and other atypical antipsychotics. I am not including risperidone in that because there are studies linking clozapine and risperidone, but so far they are coming out inconclusive in terms of their comparison. In terms of clozapine, Meltzer found that it was effective in 30 to 50% of cases where other drug therapies had failed. Okay? Now, an issue with the effectiveness is it depends on the dopamine hypothesis. And looking at the glutamate hypothesis as well, we know that the dopamine hypothesis possibly is not the full story. If that is the case, then we don't have the full picture of why antipsychotics work. So it does pose a theoretical issue more than a practical one. The other things I need to comment on are the side effects of the drugs. Typically with chlorpromazine, people were struggling with dizziness, agitation, sleepiness, stiff jaw, weight gain and itchy skin. Long-term use of chlorpromazine can lead to tardive dyskinesia. Tardive dyskinesia is a symptom or a condition where there's involuntary face movements, twitches, grimacing, blinking, etc. Okay, and in some cases some real severe facial movements. Other symptoms related to the use of chlorpromazine is neuroleptic malignant syndrome. You can just use the term NMS for short. Because of the blocking of the dopamine receptors, then what's happening is it's also blocking the dopamine action in the hypothalamus. Now, the hypothalamus is really important when it comes to thermoregulation and homeostasis. So the hypothalamus is in charge of body control regulation. NMS leads to high temperature, delirium, in some cases coma, and in some cases death. Okay? And it's found to be there in 0.1% to 2% of cases, which may seem like a low percentage, but if you then leave that to 1 in 1,000 for 0.1%, or for 1 in 50 for 2%, those aren't as low percentages as you may think. We've also looked at granulocytosis, which is a low white blood cell count that is connected with clozapine. And that is the look at drug therapy for schizophrenia. Thank you.